Bismillahirrahmanirrahim. I'm Dr. Abdul Rehman, your course instructor for a subject Human Physiology, having a course code MLT-111. Today I'm going to record part B of lecture second, that is cardiovascular system. Lecture outlines. Today we will discuss the cardiac cycle, that how blood has been circulated in the body and how heart play their role in the circulation. After this, we will discuss heart sounds because during contraction and relaxation of heart muscles, a sound has been produced that gave us the normal condition of the heart. But if there is a variation in the heart sounds, it reflects heart disease. After this, we will study out the stroke volume, that how much blood has been pumped from the heart during each heartbeat. And then we will discuss the heart rate and different factors that are involved in the regulation of the heart rate. At the end, we will calculate the cardiac output. Let's start our lecture. Cardiac cycle. Cardiac cycle is the events that take place during each heartbeat. What type of events? There are two type of events: systolic and diastolic. During systolic, there is a contraction of the heart muscles. As a result, the blood has been pumped to the circulatory system. And there are two types of circulatory system. One is called pulmonary circulation and another one is systemic circulation. While during diastole, the heart muscle become relaxed. That is also being called as a resting stage. And as a result, the heart muscles become filled with the blood. As we have discussed in the previous lectures, that heart contains four different chambers. So on the basis of the chambers, cardiac cycle has been divided into two major categories: the contraction and relaxation of the upper portion of the heart, that is atrium, are termed as arterial systole and arterial diastole, while the contraction and relaxation of the lower part of the heart, that is ventricle, called as ventricle systole and ventricle diastole. Here you can see during resting conditions, all the chambers of the heart become filled with the blood. Like on the right side, the blood came from the body tissues through veins, and first they enter into the right atrium. And once the right atrium becomes filled, the excess blood has been allowed to pass into the right ventricle. Similarly, on the left side, blood from lungs first came to the left atrium, and then from the left atrium, the excess blood has been allowed to pass into the left ventricle. This is a diastolic state in which all the chambers of the heart become filled with the blood. Once the chambers become filled with the blood, then two states will take place. One is the arterial systole and another one is the ventricle systole. During arterial systole, the blood has been pumped from the atrium into the ventricles, and the ventricles become filled with excess amount of the blood. As a result, their muscles become stimulated and contraction start, which has been called as ventricular systole. And during ventricular systoles, from the right ventricle, the blood has been pumped to the pulmonary artery and then to the lungs, while on the contraction of the left ventricles, the oxygenated blood has been passed to the aorta and then to the systemic circulation. All these events taking place within a heart, and it has been termed as cardiac cycle. Like you can see, deoxygenated blood came from the here you can see deoxygenated blood came from the body tissues to the right side of the heart, and from the right side of the heart, the blood has been pumped to the lung, where it has been clarified with respect to the different gases within exchange of different gases within environment. And after this, the blood has been allowed to pass into the left side of the heart, and from the left side of the heart, the oxygenated blood has been passed to the systemic circulation. These whole events are called as cardiac cycle. Summary of the cardiac cycle. As we have discussed, there are two circulatory systems. One is the systemic circulation and another one is the pulmonary circulation. In systemic circulation, it starts in the left ventricle. From the left ventricle, the blood has been allowed to pass into the aorta. And from the aorta, the oxygenated blood has been passed to the systemic arteries and systemic capillaries, and then it has been utilized within the body. After this, the systemic vein collect deoxygenated blood and bring it back to through superior and inferior vena cava to the right atrium. Similarly, in the pulmonary circulation, it starts in the right ventricle. From the right ventricle, the blood has been allowed to pass into the pulmonary trunk, pulmonary arteries, and then pulmonary capillaries. After this, the blood reaches to the lungs where it exchanges of gases and removal of the waste materials will take place, and from the lung through pulmonary vein, the oxygenated blood has been passed into the left side of the heart, that is called as left atrium. So this is the summary of the cardiac cycle. Heart sounds. Heart sounds are actually the noises generated during heartbeat, and it reflects the turbulence created when the heart was snapped shut. What does it mean? It means that blood came from different regions into the different chamber of the heart. Then the blood has some pressure, and during this pressure, there's a generation of the sound. That sound has been called as heart sound. And stethoscope is normally used to measure the heart sounds, and in healthy adults there are two normal heart sounds often described as loop and dub. Loop is the first heart sound and dub is the second heart sound, produced by the closing of arterioventricular and semilunar valves respectively. So here is the turbulence of the blood with the heart valves. So this turbulence create a sound that has been called as heart sound. Loop, dub, that shows the contraction, and dub, dub, that shows the diastolic condition. So these are the normal heart sounds. If there is a variation in the heart sound, it means the heart has been affected with some disease. After this, stroke volume. Stroke volume is the amount of blood that has been pumped from one ventricle of heart with each beat. And echocardiogram is normally used to measure stroke volume by using a formula that stroke volume is equal to end diastolic volume minus end systolic volume. In healthy adults having a weight of 70 kg, the end diastolic volume is 120 ml, while end systolic volume is 50 ml. So by putting these values into the above formula, we will get a difference of 70 ml for stroke volume. This is the normal stroke volume of heart. Heart rate. Heart rate is actually the number of heartbeat produced per minute, and normal human have a heart rate in the range of 60 to 100 beats per minute, and the average heartbeat is 75 beats per minute. There are certain disease conditions where the heart rate becomes show variations, like in bradycardia, that is the condition when the heart rate becomes less than 60 beats per minute, while in tachycardia, the heart rate is above 100 beats per minute, and different factors are involved in these two disease conditions. While there is arrhythmia, and there is irregular heartbeat. Sometimes it will reach to 100, and sometimes it will reach to 60. It will not be in a constant state, so they show variation. It is measured by finding pulse of heart with index and middle finger, and a good area is on neck under corner of jaw. And these three are actually the disease conditions. Regulation of heart rate. Different mechanisms are involved to regulate the heart rate. These includes local mechanism and neural mechanism. In local mechanism, the sinoatrial node, also called as pacemaker, that is located in the center of the heart, increase its rate up to 10 to 20% as follow. How? What type of mechanisms are involved? First, the venous return has been increased. As a result, there is a stretch on the arterial wall, right arterial wall, which increase permeability of sodium ions into the SA node. As a result, it increased the heart rate. So this is the local mechanism of the heart rate, that how heart rate been increased. While in neural mechanism, uh, sympathetic and parasympathetic systems are involved. In sympathetic system, positive inotropic effect develops, that is increase myocardial permeability of calcium ions, and positive chronotropic effect, which relates to increase in sodium ion influx into the sinoarterial node. As a result, the heart rate become increased. While in parasympathetic stimulation causes release of acetylcholine, which in turn increase the permeability of potassium ion into the cardiac muscles. And once the potassium ion enter into the cardiac muscles, it makes the excitable tissue become less excitable. As a result, the force of contraction of cardiac muscles drop and the heart rate decrease. Beside this, there are different factors that affect the heart rate. First one is anoxia, which is a decrease in oxygen concentration within a body tissue, and different interactions and stimulation reaction will take place in anoxia conditions, and as a result the heart rate become increased to supply more and more blood to the tissue to fulfill their oxygen demand. The second factor that affect the heart rate is acidosis. In acidosis, carbon dioxide and acid accumulates within a blood, so there is a negative feedback mechanism. In negative feedback mechanism, stimuli has been generated that decrease the heart rate. As a result, in acidosis, the heart rate become decreased. The next factor is body temperature. Fever cause an increase in the heart rate, breathing rate, and blood circulation to the skin. This is how the body tries to reduce the heat caused by fever. That's why in body temperature the heart rate become increased. Different ions also affect the heart rate, like higher concentration of potassium ion in the cardiac muscles decrease the heart rate, while higher concentration of calcium ion in the heart muscles increase the heart rate. While respiration, during respirations like exercise condition, body needs more and more oxygen. So during inspiration, heart rate increases, while during expiration, heart rate decreases. Beside this, there are some other common factors which also affect the heart rate. That includes air temperature, wind temperature, and the humidity increase. They pumps a little more blood, so your pulse rate may increase, but usually no more than 5 to 10 beats in a minute. The other factors are body position. Resting, sitting, or standing, your pulse is the same, but sometimes as you stand for the first 15 to 20 seconds, your pulse may go up a little bit, but after a couple of minutes, it should settle down. The, the other common factor are emotions. If you are stressed, anxious, or extraordinary happy or sad, your emotions can raise your pulse rate. And body size usually does not change pulse. If you are very obese, you might see a higher resting pulse than a normal person. but usually not more than 100. While medications block your adrenaline, beta blockers tend to slow your pulse rate, while too much thyroid medications or too of high dosing will raise it. So these are the normal factors that affect the body, the heart rate. Cardiac output. Cardiac output is the amount of blood that has been pumped by each side of the heart in 1 minute, and it is the product of the heart rate and stroke volume. The normal heart rate is 75 beats per minute, while the normal stroke volume of a healthy person is 70 ml. So, cardiac output has been calculated by using a formula, that is cardiac output is equal to heart rate multiplied by stroke volume. So, by putting the values of heart rate and stroke volume, we will get that 5250 ml per minute blood has been pumped by each side of the heart in 1 minute, that is equivalent to 5.25 liter per minute. And with this, there is the end of our today lecture. Thank you so much.